So we all look forward to enjoying the warmer weather in the Pacific Northwest, which is absolutely beautiful, but we also know that extreme heat can be dangerous and have health consequences. That is particularly true for older and senior adults, the very young, and people that have either mental illness or chronic conditions or pre-existing conditions such as heart disease, pulmonary disease, or diabetes, which puts them at a higher risk. Now, that doesn't mean that they're the only ones that could experience heat illness. Even very young and healthy people can be impacted by heat, especially if they're with strenuous activity. There are things that we can all do to be safe, even when it's a little bit hotter. First of all, if it's really hot, stay inside, particularly if it's cooler than what it is outside. Make sure you drink plenty of water. Drinks with caffeine or alcohol are not good for hydration. Wear lightweight, light-colored clothing, and make sure you have sunscreen in sun-exposed areas. If you must be active because of sports and or work, try to do it during the coolest parts of the day, early in the morning, late in the afternoon, and take some breaks. Now, make sure you check in with your friends, family, and neighbors, particularly if you have friends, family, and neighbors that could be either homebound or at high risk for heat illness. Follow your local news and weather to make sure you're prepared for the temperatures, and also take advantage of the cooling centers if it's something that you have access to. It is very important to stay cool, stay hydrated. Remember, water is the best thing to hydrate, and stay connected with those around you. Now, we do know that heat can have severe health consequences, and it's very important not to underestimate heat-related illness. So it's important that we all learn what to watch for, and so we can make sure that we can keep ourselves and others safe. Now, heat illness is a continuum of conditions that can come together, or one of them can be the first manifestation of heat illness. We do know that there's 3 levels of severity: heat cramps, heat exhaustion, and then heat stroke, which is by definition a medical emergency. So, how do we know that we may be experiencing heat cramps, which is usually the early first sign of heat-related illness? Well, you're going to feel muscle pains or spasms. Typically in your legs is the most common place. You will be perspiring or sweating. And if that is the case, please stop physical activity, move to the shade, cooler place, and drink some water. It's very important that you sip gently the water. Don't try to hydrate in 30 seconds. Make sure that the cramps are gone before you get physically active again. One of the things that you can do is sit down, relax, and gently stretch your legs, for example, if that's where the cramps are. Now, if those symptoms do not subside or they reoccur and it's been about an hour, please make sure that you seek medical attention from your provider. Now, you can go directly into what we know as heat exhaustion without having any cramps as an initial symptom. We do know that this is a more severe condition. And with heat exhaustion, typically what you're going to see is someone that is sweating profusely, but their skin is cold or clammy and pale. So when you touch their skin, it feels clammy, feels cold, and they're pale. Now, these individuals may also have a very weak but really fast pulse, which you can feel. They may be experiencing some nausea. They may have some cramping, but they usually will say that they feel tired or weakness or weak, or they're dizzy or have a headache. Now, we do know that people that have heat exhaustion can also just pass out. So you have to be mindful of that. So make sure that we move these individuals to a cooler place in the shade, loosen up any tight clothing, and give them to sip a little bit of water. If you have access to either ice or cold water, put some cloths that are cold on their skin, make sure that if they have access to shower or cold bath, they can do that. Now, if you have done all of that and the symptoms either continue, get worse, or last longer than an hour, please seek medical attention. Now, this brings me to the most severe form of heat-related illness, which is heat stroke. As I mentioned, this is a medical emergency. This is going to be a little bit different than the cramping on the exhaustion. So what you're going to see is someone whose body temperature is extremely high, and they have a very fast, strong pulse. But you will also notice that these individuals may be confused, may be disoriented, will complain typically of headache or dizziness or nausea, and they actually may just lose consciousness or pass out. If you're somebody that is exhibiting the signs and symptoms of heat stroke, first thing to do is call 911. Make sure you're getting medical attention. Gently move them to a cooler place and try cool clothes or a cool bath if you can. It is important, if you have access to ice bags, put some under their armpits just to make sure you bring that body temperature down. Now, one of the questions that people ask is, should I give them water immediately? And the answer is no. Be careful with drinking because they may not be oriented enough to be able to drink water or any other thing. So the first thing to do is try to keep their body temperature, lower their body temperature, call 911, and make sure that medical attention is provided. Now, we can all do the things that I just mentioned, and I want to emphasize again that it is important that we all pay attention to each other, and let's make sure that if we have older neighbors, friends, or relatives, or young children in particularly, remember that occasionally they will just run off and you have to keep an eye on them. But if you also have someone, a friend, neighbor, or relative that has one of the chronic conditions that we mentioned or mental disease, make sure that you're paying attention to them. Make sure that you remove them from heat exposure if possible, and check on them if it gets really hot, particularly if someone is homebound. As a community, if we do this and work together and stay in touch, I'm sure that we will be able to take care of anyone and prevent the more serious complications of heat illness.